Now, Deputy David Cullinane.
First of all, welcome the Ambassador from Ukraine in the chamber here today, and to say that we stand with the people of Ukraine, and to welcome all of the guests in the visitors' gallery as well. I'm sure the entire House will join with me in unreservedly condemning the attack on an off-duty police officer in Omagh last night. My thoughts are with the officer injured in the shooting and his family, who will be traumatised by this attack. It is an attack on the entire community and must be condemned in the strongest possible terms. Anybody with any information on this attack should bring it forward to the police, and the sooner those responsible are behind bars, the better. Can I also, on behalf of Sinn Féin, wish Catherine Murphy and Roisin Shortall well, following their announcement that they are standing down from their leadership positions as well, and my best regards to them and their families. Taoiseach, yesterday the Health Information and Quality Authority, HIQA, published a report on the emergency department at University Hospital Limerick, which found non-compliance with 5 national standards, a significant deficits in governance and management arrangements, gross overcrowding and major patient flow issues, and a significant shortage of medical and nursing staff. Also yesterday, the Irish Nurses and Midwives Organisation published Trolley Watch figures that showed more than 100 people on trolleys in University Hospital Limerick, and more than 600 people on trolleys across the state on Monday, Tuesday and Wednesday of this week. Taoiseach, there was only one day so far this year when we had less than 400 patients on a trolley, and that's simply not good enough. Emergency department waiting times are through the roof under your government. Patients in need of emergency care are now waiting 20% longer than in 2019, which is nearly 3 hours longer. Last year, patients who were admitted to hospital through an emergency department waited for more than 12 hours on average. In December of last year, it was a scandal when patients had to wait for more than 15 hours on average, and for those over age 75, Taoiseach, it was 17 hours on average across all hospitals, and some hospitals are performing even worse. In your own constituency, in Cork, Taoiseach, the average wait time at the emergency department in the Mercy Hospital and Cork University Hospital was over 24 hours. And scandalously, in the month of December last year, older people aged over 75 were forced to wait for 40 hours at Cork University Hospital. Now, how, Taoiseach, can you stand over that? Older people over 75 in your own constituency waiting over 40 hours, many of them waiting days on end. This is beyond scandalous and is happening on your watch. Hospital overcrowding is also causing problems for the ambulance service, and we heard that yesterday at the Oireachtas Health Committee. In Dublin, the average hospital turnaround time last year was 39 minutes, and in 16% of cases it was in excess of an hour. Ambulance response times in general are up 50% since 2019. Taoiseach, every ambulance waiting for 40 minutes to transfer a patient is an ambulance which has been needlessly taken off the road. Overcrowding, as you know, also leads to cancellations and disrupts waiting lists. So, Taoiseach, in Budget 2022 and in Budget 2023, your government and the Minister for Health did not fund one additional acute inpatient bed beyond what was funded in Budget 2021. Not one single bed. We know from discussions that we've had with hospitals managers across the state that are crying out for more capacity, crying out for more beds, and yet this Minister and your government are not delivering. What you're seeing in emergency departments are people waiting for far too long. The Minister acknowledges people are waiting far too long, but there is no plan. How, Taoiseach, can you stand over in the month of December last year, older people aged over 75 in your own constituency waiting over 40 hours for access to a bed? Some of them days on end. It's not acceptable, and my question to you is, will you put the additional bed capacity in now so that next year and next winter we don't have the same problems we had this year?
Taoiseach, please.
First of all, thank you, Ceann Comhairle, for your reminding us of the horrors of nuclear war and your comments in relation to the terrible war being waged upon the people of Ukraine as a result of the illegal and immoral invasion of Ukraine by the Russian Federation. And closer to home, like many others, I too find myself struggling to comprehend the savagery and depravity of last night's attack on Detective Chief Inspector John Caldwell, a man whose day job is finding and prosecuting the worst and most dangerous threats to his community, and a man who was spending his free time working with young people at a sports centre, coaching them in teamwork, friendship, fitness, and so forth. He was there with his young son, putting away the equipment, and two individuals with weapons walk up and fire multiple shots into his body, shooting him again and again. And they do everything in their power to try and kill him in front of his young son and other children. The very best sort of a man attacked by the very worst. And I'm sure we're all in this House united in articulating our absolute and heartfelt disgust and condemnation of those behind the attack last evening. And as has been said by Deputy Cullinane, anybody who has any information at all is duty-bound and should give that information to the policing authorities. And we know that many thousands of others understand the trauma that such attacks and similar experiences over the decades have caused, and we do not want to go back to that, and we will not go back to that. And I welcome the joint statement of all the political parties in the North, which has been issued this morning in response to this. Unsiú fásach ag an dát agus os córavach agus daoine óga agus ní lein áras ach Ibrín John Call go dtíon díoch lá an ag léib chun muintear an túisceart a chosint agus táidig smíanamh agus a chlán go léir agus na daoine tá freagadh as an únsí seo caiimiid iad a chuirt os cór na cuairte. In respect of the health services, if I may, Ceann Comhairle, and in response to the Deputy's comments, to make the overall point that there's been unprecedented investment actually since this government came into office in our health services. The emergency waiting times and the large numbers attending is a cause of concern, and particularly in some hospitals, in the University Hospital Limerick and in Cork University Hospital and the Mercy Hospital and others. It also needs to be pointed out that activity levels in our hospitals has gone up significantly. And obviously post-COVID, there has been a significant impact on our hospitals, and COVID continues to have an impact and has had an impact over the last winter period. Over 1,000 beds have been provided since this government came into office. 1,000 beds, which you omitted to acknowledge in your comments, giving the impression that no beds at all were put. But we need to do more, and we will provide more beds. In direct answer to your question, we will provide more beds and more capacity. And the focus now of Government and the Minister for Health is to identify the provision of additional acute hospital beds through modern methods of construction that would deliver those beds much faster and more quickly than conventional procurement and conventional provision of such beds. But in addition to that, I think you must acknowledge that the Enhanced Community Care Programme has been a significant success in terms of focusing a lot of healthcare, not just in primary care, but obviously in primary care, because primary care is working very strongly with enhanced community care. But that ultimately is the most effective way, I think, to prevent overcrowding in emergency departments and to give people treatments in the right location at the right time by the right physicians.
Deputy Cullinane.
Tánaiste, you said that the wait times in University Hospital Cork and in Limerick are a cause for concern. It's not just a cause for concern, they are absolutely unacceptable. It's shocking, it's scandalous. And I put it to you again, in your own constituency, people over the age of 75 who deserve better and should be treated with respect and dignity, waiting on average 40 hours in the month of December. That is a scandal. Now, you talked about the beds. 1,200 beds were funded in Budget 2021, yes. About 200 of those beds are still not delivered, but you seem to think that's it. Nothing in 2022 in that budget, nothing in 2023 in that budget. You seem to think the job is done, and yet we have hospital management across the state screaming out for more beds and more capacity. So you have to do more, and it isn't just beds. It is what's happening in the community as well. We don't have enough step-down beds and recovery beds. We don't have enough GPs. Out-of-hours GP services is collapsing. All of that is putting huge pressures on our hospitals and on our emergency departments. And despite your talk, Tánaiste, you simply haven't done enough, and much more needs to be done.
Tánaiste.
I think in terms of Cork, in my own time, we did unprecedented investment in the infrastructure in Cork. Regrettably, during the last while, significant proposals didn't come forward to the degree that they should have in terms of coming from the region, and I'm very well aware of it. They are now coming in, the projects, and that has been a cause of concern for me in terms of the lack of ready-to-go projects in respect of certain hospitals. That's why we're looking at a faster method in terms of getting projects delivered. We're saying we're going to build more facilities and expand the number of beds. We're going to do that on top of an unprecedented 1,000 beds since 2020. No, in any previous decade, we didn't experience in recent times a similar expansion of hospital beds. But parallel with that, about a massive increase in the number of people working within our health service. 17,000 more people working now in our health service than at the beginning of 2020. That's a 15% increase. That's over 5,000 nurses. That's nearly 3,000 health and social care professionals and 1,800 doctors and dentists. And we need to do more, and we will do more in terms of providing additional capacity, both in personnel terms and in bed terms.
Thank you very much.